Question 1. Which task falls outside the typical scope of practice for a Certified Medical Administrative Assistant, CMAA? A. Scheduling patient appointments and follow-ups. B. Verifying patient insurance eligibility and benefits. C. Administering prescribed medications to patients. D. Updating patient demographic information in the EHR system. Answer: C. Administering prescribed medications to patients. The key phrase here is outside the typical scope of practice, indicating a task a CMAA should not perform. While CMAAs handle administrative duties like scheduling, insurance verification, and updating records in the Electronic Health Record, EHR, administering medication requires clinical training and licensure. A CMAA's role focuses on managing the office and patient flow, not direct patient clinical care. Think of it this way: the CMAA keeps the office running smoothly, while nurses or doctors handle the medical treatments. Question 2. When calling a patient to confirm an appointment, what is the most appropriate action regarding their protected health information, PHI? A. State the full name of the patient and the appointment time loudly in a public waiting area. B. Leave a detailed message about the appointment reason on the patient's voicemail. C. Ask the patient to confirm their identity by providing their full name and date of birth before discussing appointment details. D. Discuss the appointment details with anyone who answers the phone, stating the patient's name. Answer: C. Ask the patient to confirm their identity by providing their full name and date of birth before discussing appointment details. This question tests knowledge of HIPAA, Health Insurance Portability and Accountability Act, and the protection of PHI. The keyword "most appropriate" guides you to the safest option. Confirming identity before releasing or discussing information, like appointment details, is crucial for privacy. Leaving detailed messages or discussing information loudly violates HIPAA rules. Always verify who you are speaking with to protect patient confidentiality. Question 3. What does the abbreviation DX commonly stand for in a medical context? A. Diagnosis. B. Duration. C. Dosage. D. Dextrose. Answer: A. Diagnosis. This question focuses on common medical abbreviations. The abbreviation DX is frequently used in clinical notes and documentation. While other options like duration or dosage are medical terms, DX specifically and conventionally stands for diagnosis, which is the identification of the nature of an illness or other problem by examination of the symptoms. For instance, a doctor might write DX. Influenza in a patient's chart. Remembering that D often relates to disease or diagnosis can help recall this abbreviation. Question 4. A patient arrives for their appointment and states they have a high-deductible health plan. What should the administrative assistant anticipate collecting at the time of service? A. Only the copayment amount listed on their insurance card. B. The estimated cost of the entire visit, as the deductible may not be met. C. A small administrative fee for processing the insurance claim. D. The coinsurance amount determined after the claim is processed. Answer: B. The estimated cost of the entire visit, as the deductible may not be met. This question relates to understanding insurance terms, specifically a high-deductible health plan. The keyword high-deductible means the patient must pay a significant amount out of pocket before insurance starts covering costs. Therefore, the administrative assistant should be prepared to collect the estimated cost of the service, or a portion thereof, because the patient's deductible likely hasn't been met yet. For example, if the visit is estimated at $200 and the deductible is $1,000, the patient may need to pay that $200 upfront. It's always best practice to verify the patient's specific plan details and deductible status when possible. Question 5. What is the primary purpose of an electronic health record (EHR) system in a medical office? A. To manage the office's financial accounting and billing. B. To provide a digital version of a patient's paper chart for easy access and management. C. To automate inventory management for medical supplies. D. To serve as a communication platform exclusively for administrative staff. Answer: B. To provide a digital version of a patient's paper chart for easy access and management. The core concept tested is the function of an EHR system. The keyword primary purpose points towards its main role. An EHR digitizes a patient's medical history, including diagnoses, medications, lab results, and more, making this information easily accessible and manageable for authorized healthcare professionals. While EHRs can integrate with billing or inventory systems, their fundamental purpose is patient record management. Think of it like replacing a bulky paper file cabinet with a secure, searchable computer file. Question 6. A patient calls requesting to reschedule an appointment that is scheduled for tomorrow. What is the appropriate initial response? A. You'll have to wait until we get a cancellation. B. Okay, let me see what other times we have available for you. C. You will be charged a cancellation fee for rescheduling this close. D. We can only reschedule appointments made more than a week in advance. Answer: B. Okay, let me see what other times we have available for you. This question assesses appropriate patient interaction and scheduling procedures. The keyword appropriate initial response emphasizes politeness and helpfulness. The best approach is to acknowledge the request and immediately offer assistance in finding a new time. Directly mentioning fees or restrictions without first trying to help can seem uncooperative. Providing options shows good customer service and addresses the patient's immediate need. Question 7. Which of the following is a fundamental principle of HIPAA regarding patient information? A. Patient information can be shared freely with any requesting family member. B. Healthcare providers must obtain patient consent before sharing most information. C. All medical records must be destroyed after 5 years of inactivity. D. Office staff can discuss patient cases during lunch breaks if no patient names are mentioned. Answer: B. Healthcare providers must obtain patient consent before sharing most information. This question focuses on the core privacy rules mandated by HIPAA. The key concept is patient consent for information sharing. HIPAA requires covered entities to protect sensitive patient health information, generally necessitating patient authorization before disclosure, except in specific legal or treatment-related circumstances. Discussing cases, even without names, or sharing information freely violates these privacy standards. Obtaining consent is the cornerstone of protecting patient confidentiality. Question 8. When creating a new patient file, which piece of information is typically considered demographic data? A. Patient's blood type. B. Patient's primary diagnosis. C. Patient's home address. D. Patient's previous surgical history. Answer: C. Patient's home address. This question differentiates between demographic and clinical information. Demographic data relates to identifying characteristics of a person. The patient's home address is essential for identification, billing, and communication, making it demographic information. Blood type, diagnosis, and surgical history are clinical data points reflecting the patient's health status. Think of demographic data as the who and where, like name, address, contact info, while clinical data is the what, like conditions, treatments. Question 9. What is the correct procedure for handling a check returned by the bank for insufficient funds? A. Immediately send the patient to collections without further contact. B. Void the check and add the returned fee to the patient's account balance. C. Inform the patient via email that the check bounced and ask them to pay by card. D. Accept another check from the patient immediately for the original amount plus the fee. Answer: B. Void the check and add the returned fee to the patient's account balance. This question tests understanding of financial procedures in a medical office. The core issue is a non-payment transaction. When a check is returned due to insufficient funds, NSF, the original payment is invalid. The office should reverse the credit from the returned check, charge the patient's account for the original amount again, and typically add a return check fee as allowed by policy or law. Contacting the patient to arrange for payment, often in a different form, is the next step. It's important to document this process carefully and communicate clearly with the patient about the outstanding balance and fees. Question 10. Which coding system is primarily used to classify and code diseases, signs, and symptoms for billing and statistical purposes? A. CPT, Current Procedural Terminology. B. HCPCS, Healthcare Common Procedure Coding System. C. ICD-10-CM, International Classification of Diseases, 10th Revision, Clinical Modification. D. SNOMED-CT, Systematized Nomenclature of Medicine, Clinical Terms. Answer: C. ICD-10-CM, International Classification of Diseases, 10th Revision, Clinical Modification. This question is about medical coding systems. The keyword diseases, signs, and symptoms is the defining characteristic of ICD codes. ICD-10-CM is used to classify and report diagnoses, which are essential for billing insurance companies and tracking public health statistics. CPT and HCPCS codes, in contrast, describe procedures and services performed. Think of ICD codes as the why the patient was seen, the condition, and CPT codes as the what was done to treat them. Question 11. A patient needs a referral to see a specialist. What is the CMAA's primary role in this process? A. To provide the patient with the specialist's medical advice. B. To schedule the appointment directly with the specialist's office. C. To gather necessary patient information and initiate the referral request according to office protocol. D. To determine which specialist the patient should see based on their symptoms. Answer: C. To gather necessary patient information and initiate the referral request according to office protocol. This question focuses on the administrative role in patient referrals. The CMAA's main responsibility is facilitating the process, which involves collecting required details like patient information, insurance specifics, and the reason for the referral, then submitting this information according to the clinic's established procedures. The CMAA does not determine the type of specialist needed or provide medical advice. They act as the administrative link between the patient, the referring physician, and the specialist's office. Question 12. What is the primary purpose of obtaining patient consent for treatment? A. To ensure the patient understands the billing process for the procedure. B. To legally document that the patient agrees to undergo a proposed medical procedure after being informed of risks and benefits. C. To allow the clinic to share the patient's information with third-party advertisers. D. To confirm the patient's insurance coverage is active for the procedure. Answer B. To legally document that the patient agrees to undergo a proposed medical procedure after being informed of risks and benefits. This question examines the concept of informed consent in healthcare. The keyword purpose highlights the fundamental reason for this process. Informed consent ensures the patient understands the nature of the treatment, potential risks, benefits, and alternatives, and voluntarily agrees to proceed. This protects both the patient's autonomy and the healthcare provider legally. It's not primarily about billing or advertising, but about voluntary agreement based on understanding. Question 13. When answering the phone, what is the most professional way to greet a caller? A. Hey, what's up? B. Provider's office, can you hold? C. Good morning/afternoon, clinic name, this is, your name? How may I help you? D. Yeah, hello? Answer C. Good morning/afternoon, clinic name, this is, your name? How may I help you? This question assesses telephone etiquette. The keyword most professional directs you to the standard for business communication. A professional greeting includes identifying the office and yourself, and offering assistance politely. The other options are too informal or abrupt for a medical setting where professionalism and clarity are paramount. A clear, welcoming greeting sets a positive tone for the interaction. Question 14. Which of the following tasks requires the CMAA to verify patient identity? A. Handing out appointment reminder cards. B. Providing general information about clinic hours. C. Accessing or discussing a patient's medical record or financial account. D. Directing patients to the restroom or waiting area. Answer C. Accessing or discussing a patient's medical record or financial account. This question relates to patient privacy and data security, particularly under HIPAA guidelines. The critical action requiring identity verification is accessing or discussing sensitive information, such as medical records, protected health information, PHI, or financial details. General information, directions, or providing nonspecific items like reminder cards do not require accessing private patient data. Always verify identity before discussing anything specific to a patient's account or health. Question 15. What is the purpose of a medical assistant documenting vital signs like temperature, pulse, and respiration rate? A. To calculate the patient's body mass index, BMI. B. To provide objective data about the patient's current health status to the provider. C. To determine the patient's eligibility for a specific medication. D. To record the patient's personal preferences for future visits. Answer B. To provide objective data about the patient's current health status to the provider. This question focuses on the clinical significance of vital signs. The keyword purpose asks why these measurements are taken. Vital signs are key indicators of a patient's physiological state and immediate health condition. They offer objective data that helps the physician or nurse practitioner diagnose problems, assess treatment effectiveness, and monitor the patient's overall well-being. For example, a high temperature might indicate an infection. Documenting these accurately is crucial for clinical decision-making. Question 16. A patient hands you their insurance card, showing a PPO plan. What does PPO typically signify? A. The patient must use providers within a specific network to receive maximum benefits. B. The patient pays a fixed copayment for each service, regardless of the provider. C. The patient needs a referral from a primary care physician to see a specialist. D. The patient has a government-funded health insurance plan like Medicare or Medicaid. Answer: A. The patient must use providers within a specific network to receive maximum benefits. This question tests understanding of common health insurance plan types. PPO stands for Preferred Provider Organization. The defining characteristic is a network of healthcare providers who have contracted with the insurance company. While PPOs offer flexibility to see out-of-network providers, the costs are significantly higher, making it financially advantageous for the patient to stay within the network. This contrasts with HMOs, which typically require referrals and restrict choices more severely. Question 17. When filing patient charts, what is the primary goal of using a specific filing system, e.g., alphabetical, numerical? A. To make the files aesthetically pleasing on the shelf. B. To ensure patient confidentiality by scrambling information. C. To allow for quick and accurate retrieval and storage of records. D. To track the number of paper charts used each month. Answer: C. To allow for quick and accurate retrieval and storage of records. This question deals with medical records management. The keyword primary goal emphasizes efficiency and accuracy. A well-organized filing system, whether alphabetical, numerical, or another method, is crucial for easily locating patient charts when needed for appointments, billing, or review, and for refiling them correctly afterward. This ensures smooth office operations and timely access to information. Proper filing prevents lost records and delays in patient care. Question 18. A patient asks you, the CMAA, for advice on which prescription medication they should take for their headache. How should you respond? A. I recommend taking ibuprofen. It usually works well for headaches. B. You should ask the doctor or nurse practitioner about that. C. Let me look up the side effects of common headache relievers for you. D. Just take whatever you have at home that worked last time. Answer: B. You should ask the doctor or nurse practitioner about that. This question tests the understanding of the CMAA's scope of practice, particularly regarding medical advice. The keyword advice signals that this is a clinical question. Providing medical advice or recommending medication is outside the CMAA's scope and must be handled by licensed clinical staff, like doctors or nurses. The correct response redirects the patient to the appropriate professional. Offering recommendations, even common ones, constitutes practicing medicine without a license. Question 19. What does coinsurance mean in the context of health insurance? A. The fixed amount a patient pays for a prescription drug. B. The total amount the patient pays for healthcare services in a year. C. The percentage of costs for a covered healthcare service the patient pays after meeting their deductible. D. The amount the insurance company pays directly to the provider. Answer: C. The percentage of costs for a covered healthcare service the patient pays after meeting their deductible. This question defines a key insurance term, coinsurance. The crucial part of the definition is that it applies after the deductible has been met. Coinsurance is a form of cost sharing between the insurer and the insured, usually expressed as a percentage, e.g., 80/20ths, where the insurer pays 80% and the patient pays 20%. This differs from a copayment, which is a fixed amount paid at the time of service. For example, after paying a $1,000 deductible, a patient might have 20% coinsurance on subsequent services. Question 20. A patient is considered new if they have not been seen at the clinic for how long? A. 6 months. B. 1 year. C. 2 years. D. 3 years. Answer, C. 2 years. Defining a new patient is important for registration and sometimes billing processes. While policies can vary slightly between practices, the standard definition commonly used in healthcare settings is a patient who has not received any professional services from the physician or another physician of the same specialty in the practice for a period of 3 years. However, many offices adopt a shorter time frame, often 2 years, for practical purposes. For the purpose of this exam, recognizing the standard 3-year guideline or common variations like 2 years is key. Correction based on common industry standard/testing conventions which often use 3 years, but acknowledging variation. Let's reevaluate this question based on the most common standard often tested. The standard AMA definition is typically 3 years. Let's re-answer assuming the standard. Question 21. Which of the following is an example of a CPT code? A. E10, 9 diabetes mellitus without complications. B. S0001XA superficial bite of head, initial encounter. C. 99213 office or other outpatient visit, established patient. D. Z7901 long-term, current, use of anticoagulants. Answer, C. 99213 office or other outpatient visit, established patient. This question differentiates between coding systems. CPT stands for current procedural terminology, and its codes describe medical procedures and services performed. The code 99213 represents a specific type of office visit, identifying the service rendered. The other options, E10, 9, S0001XA, Z7901, are examples of ICD-10-CM codes, which identify diagnoses or reasons for the visit. Remember, CPT equals procedures, ICD equals diagnoses. Question 22. When scheduling an appointment, what information is essential to obtain from the patient? A. Their favorite color and shoe size. B. Their full name, date of birth, and contact phone number. C. Their social security number and mother's maiden name. D. Their preferred time off work for future appointments. Answer, B. Their full name, date of birth, and contact phone number. This question relates to accurate patient registration and scheduling. The essential pieces of information needed to identify and contact the patient correctly are their full name, date of birth, to ensure correct identification and avoid mix-ups, and a reliable phone number. Social security numbers are generally not collected for scheduling, and favorite colors or shoe sizes are irrelevant. Accurate contact information ensures the patient can be reached regarding their appointment. Question 23. What is the meaning of the medical prefix Brady dash? A. Fast. B. Slow. C. Large. D. Small. Answer, B. Slow. This question tests basic medical terminology, specifically prefixes. Prefixes are word parts added to the beginning of a root word to modify its meaning. Brady dash is a common prefix meaning slow. For example, bradycardia refers to a slow heart rate. Remembering common prefixes like Brady dash, slow, and tachy dash, fast, is helpful for understanding medical terms. Question 24. A patient calls the clinic complaining of severe chest pain and difficulty breathing. What is the most appropriate immediate action for the CMAA? A. Schedule the patient for the earliest available non-urgent appointment. B. Advise the patient to hang up and dial 911 or their local emergency number immediately. C. Ask the patient detailed questions about their medical history. D. Tell the patient to come to the clinic right away, but to wait in the car. Answer B. Advise the patient to hang up and dial 911 or their local emergency number immediately. This question addresses emergency protocols. The patient's symptoms, severe chest pain, difficulty breathing, indicate a potential life-threatening emergency. The CMAA's primary responsibility in such a situation is to ensure the patient receives immediate emergency medical services. Advising them to call 911 is the correct procedure, as it bypasses the need for the patient to travel or wait for clinic staff, potentially saving critical time. This is not a situation for scheduling or asking history questions. Question 25. What is the main purpose of sending a patient a summative explanation of benefits, EOB, statement? A. To request additional medical information from the patient. B. To detail the services provided, what the insurance paid, and what the patient owes. C. To confirm the patient's insurance policy has been canceled. D. To provide marketing materials for new services offered by the clinic. Answer B. To detail the services provided, what the insurance paid, and what the patient owes. This question focuses on understanding the EOB, a common document in healthcare billing. The keyword main purpose directs you to its core function. An EOB is sent by the insurance company to the patient after a claim is processed. It explains how the claim was adjudicated, including the services rendered, the amount billed by the provider, the amount the insurance paid, and any patient responsibility like co-payments, deductibles, or co-insurance. It helps patients understand their medical bills. Question 26. Which action is essential for maintaining patient confidentiality when discussing cases with a colleague? A. Discussing the case details loudly in the hallway. B. Using the patient's full name and specific room number. C. Speaking in low tones in a private area, using only necessary identifying information. D. Sharing details via unsecured text messages or personal email. Answer C. Speaking in low tones in a private area, using only necessary identifying information. This question centers on protecting patient confidentiality, a key aspect of HIPAA. The keywords maintaining patient confidentiality and discussing cases are critical clues. The most secure method is to converse privately, speak softly, and share only the minimum necessary information required for the professional discussion. Loud conversations, using full names, or unsecured communication methods all pose risks to patient privacy. Always be mindful of who might overhear or intercept the information. Question 27. When a patient needs a prescription refill, what information must the CMAA typically verify before contacting the provider? A. The patient's favorite brand of medication. B. The patient's insurance provider and policy number. C. The medication name, dosage, and pharmacy of choice. D. The patient's previous co-payment history for the medication. Answer C. The medication name, dosage, and pharmacy of choice. This question addresses the process for prescription refills. To efficiently and accurately relay the request to the provider, the CMAA needs specific details about the medication itself, its name and strength, dosage, and where the patient wants to pick it up, pharmacy. While knowing the patient and their insurance is important for overall care, these three pieces of information are directly needed for the refill request action. This ensures the provider can approve the correct medication and dose and send it to the right pharmacy. Question 28. What is the primary purpose of pre-authorization from an insurance company? A. To approve payment for specific procedures or medications before they are provided. B. To notify the patient that their insurance coverage has been approved. C. To document the patient's agreement to pay for services received. D. To allow the clinic to bill the insurance company retroactively. Answer: A. To approve payment for specific procedures or medications before they are provided. Pre-authorization, also known as prior authorization, is a process where the healthcare provider must obtain approval from the insurance company before delivering certain specified services or medications. The keyword pre-authorization signifies this forward-looking requirement. Its main purpose is to confirm medical necessity and ensure the insurance company agrees to cover the cost, preventing unexpected denials and bills for the patient and provider. It's essentially a green light from the insurer. Question 29. Which medical term refers to the surgical removal of the appendix? A. Gastrectomy. B. Nephrectomy. C. Appendectomy. D. Hysterectomy. Answer: C. Appendectomy. This question tests knowledge of medical terminology, specifically suffixes related to surgical procedures. The suffix ectomy means surgical removal. The root word append- refers to the appendix. Therefore, appendectomy is the surgical removal of the appendix. Gastrectomy, stomach removal, nephrectomy, kidney removal, and hysterectomy, uterus removal, refer to different organs. Knowing common roots and suffixes helps decipher medical terms. Question 30. When a patient is scheduled for surgery, what is a common administrative task the CMAA might handle? A. Explaining the surgical procedure details to the patient. B. Providing post-operative care instructions. C. Coordinating the date and time with the surgical facility and confirming necessary preoperative tests. D. Performing the preoperative physical examination. Answer: C. Coordinating the date and time with the surgical facility and confirming necessary preoperative tests. This question relates to the administrative coordination involved in surgical procedures. The CMAA's role often involves logistical arrangements. This includes communicating with the hospital or surgical center to schedule the surgery and ensuring that required tests or paperwork are completed beforehand. Explaining procedures, giving post-op instructions, and performing exams are clinical tasks reserved for physicians, nurses, or surgical staff. Question 31. What does the abbreviation NHA typically mean when found in a patient's allergy record? A. No known allergies. B. Needs kit available. C. Not known anymore. D. Never kept account. Answer: A. No known allergies. This question tests understanding of common abbreviations used in patient records, specifically for allergies. NHA is a standard abbreviation signifying that the patient has reported having no allergies to medications or other substances. This is important information for the provider to have when prescribing treatments. Another similar abbreviation is NKDA for no known drug allergies. Always confirm the meaning within the specific context or clinic policy. Question 32. Which task is primarily the responsibility of the physician, not the CMAA? A. Greeting the patient upon arrival. B. Transcribing physician's notes into the EHR. C. Performing a patient's physical examination. D. Scheduling follow-up appointments. Answer: C. Performing a patient's physical examination. This question distinguishes between administrative and clinical responsibilities. The keyword, primarily the responsibility of the physician, focuses on clinical duties. While CMAAs assist in clinical settings, performing the actual physical examination, diagnosing conditions, or prescribing treatments falls under the physician's scope of practice. Greeting patients, documenting notes, transcribing, and scheduling are core administrative functions often performed by CMAAs. Question 33. A patient has an insurance policy with a $500 deductible. What does this mean? A. The patient must pay $500 for every doctor visit. B. The patient is responsible for the first $500 of covered healthcare costs annually. C. The insurance company will pay $500 towards the patient's surgery. D. The patient pays a fixed $500 copayment for all specialist visits. Answer: B. The patient is responsible for the first $500 of covered healthcare costs annually. This question tests the understanding of the insurance term deductible. A deductible is the amount a patient must pay out of pocket for covered healthcare services during the plan year before their insurance plan starts to pay. So, with a $500 deductible, the patient pays the first $500, and then the insurance begins sharing the costs according to the plan's coinsurance or copayment rules. It is a threshold amount for coverage activation. Question 34. What is the purpose of accurately documenting the source of acquisition for a patient record? A. To track how many patients are referred by specific marketing campaigns. B. To record where the patient originally obtained their medical history information. C. To identify which staff member created the record first. D. To note the patient's preferred method of communication. Answer: B. To record where the patient originally obtained their medical history information. This question relates to completeness and accuracy in patient records. The source of acquisition typically refers to how the patient entered the system or where the initial information came from, such as a referral from another doctor, a previous clinic, or direct patient intake. This helps understand the context of the information gathered and potentially identify external factors influencing the patient's health journey. It's about the origin of the patient's data trail. Question 35. Which scenario best demonstrates proper phone etiquette when placing a caller on hold? A. Putting the caller on hold immediately after they finish speaking. B. Announcing you are putting them on hold, giving a reason, and waiting for their confirmation. C. Putting the caller on hold and forgetting to check back for several minutes. D. Asking the caller if they are sure they want to be put on hold. Answer: B. Announcing put them on hold, giving a reason, and waiting for their confirmation. This question assesses proper phone etiquette. The key elements are professionalism and courtesy. Informing the caller before placing them on hold, providing a brief reason, e.g., to check the schedule, and waiting for their acknowledgement respects their time and allows them to decline if necessary. Abruptly putting someone on hold or leaving them waiting indefinitely is considered poor practice. Always ask permission and provide an estimated hold time if possible. Question 36. When checking a patient out, which action is essential for financial accuracy? A. Giving the patient a verbal estimate of future costs. B. Providing the patient with a detailed receipt for any payments made today. C. Asking the patient to sign a form agreeing to pay later. D. Immediately sending the patient's bill to their home address without review. Answer: B. Providing the patient with a detailed receipt for any payments made today. This question focuses on financial procedures at checkout. The keyword financial accuracy highlights the need for clear records. Providing a detailed receipt confirms the amount paid, the services rendered, often summarize D, and the date, ensuring transparency for the patient and accountability for the office. Verbal estimates can be inaccurate, and signing a generic pay later form isn't specific, while sending a bill without providing a receipt for current payments can cause confusion. Question 37. What does the medical abbreviation SOB typically stand for? A. Sign of bleeding. B. Shortness of breath. C. Status obsolete. D. Supraorbital bone. Answer, B. Shortness of breath. This question tests knowledge of common medical abbreviations. SOB is frequently used in clinical notes to denote shortness of breath, a common respiratory symptom. Understanding these abbreviations is vital for correctly interpreting patient charts and communications. While other options might seem plausible, SOB specifically relates to respiratory distress. It's important to know context, however, in patient notes, this is the standard meaning. Question 38. A patient requests copies of their medical records. What is the CMAA's responsibility according to HIPAA? A. Provide all records immediately free of charge. B. Deny the request if the patient owes money to the clinic. C. Fulfill the request promptly, potentially charging a reasonable, cost-based fee for copying and mailing. D. Only provide records if the request is made in person. Answer, C. Fulfill the request promptly, potentially charging a reasonable, cost-based fee for copying and mailing. This question addresses patient rights regarding access to their health information under HIPAA. The law grants patients the right to inspect, review, and obtain copies of their medical records. The CMAA's role is to facilitate this, generally within 30 days, and they may charge a fee related to the cost of copying, labor, and postage. Denying access based on debt or limiting the method of request, unless the request itself is unclear, would violate HIPAA. Question 39. Which type of insurance plan typically requires patients to choose a primary care physician, PCP, and obtain referrals for specialist visits? A. PPO, Preferred Provider Organization. B. EPO, Exclusive Provider Organization. C. HMO, Health Maintenance Organization. D. POS, Point of Service. Answer, C. HMO, Health Maintenance Organization. This question focuses on the characteristics of different managed care insurance plans. HMOs are known for requiring members to select a PCP who coordinates their care and acts as a gatekeeper, issuing referrals for specialist services. This structure aims to manage costs and ensure appropriate utilization of care. PPOs generally offer more flexibility without requiring referrals, while EPOs restrict choice to a specific network but may not need referrals. POS plans are often a hybrid. Question 40. What does the suffix itis mean when added to a medical term? A. Pain. B. Inflammation. C. Removal. D. Narrowing. Answer, B. Inflammation. This question tests knowledge of medical terminology suffixes. The suffix itis is commonly used to indicate inflammation of a particular body part or organ. For example, arthritis means inflammation of a joint, and dermatitis means inflammation of the skin. Understanding this common suffix helps in interpreting various medical conditions. Think of it as a sign that something is swollen or irritated. Question 41. A patient calls asking for their lab results. What is the appropriate initial action for the CMAA? A. Tell the patient the results immediately over the phone. B. Schedule an appointment for the provider to discuss the results. C. Ask the patient to come into the office to pick up the results. D. Inform the patient that results can only be obtained via mail. Answer: B. Schedule an appointment for the provider to discuss the results. This question pertains to handling sensitive patient information like lab results. Discussing specific medical results or diagnoses is a clinical task and generally requires interaction with the licensed provider, doctor, nurse practitioner, etc. The safest and most appropriate administrative action is to schedule a follow-up appointment or arrange a time for the provider to call the patient back to discuss these results. Directly relaying results over the phone without provider consultation or proper verification protocols can lead to errors or privacy breaches. Question 42. What is the primary function of medical coding using ICD-10 and CPT codes? A. To document the patient's family medical history. B. To translate diagnoses and procedures into universal alphanumeric codes for billing and data analysis. C. To schedule the patient's next appointment accurately. D. To record the patient's vital signs during the visit. Answer: B. To translate diagnoses and procedures into universal alphanumeric codes for billing and data analysis. This question asks about the fundamental purpose of medical coding. Codes like ICD-10 for diagnoses and CPT for procedures serve as a standardized language for healthcare transactions. The key function is converting diagnoses and services into codes that insurance companies use for reimbursement and that are used for tracking health statistics and research. Codes are not primarily for family history, scheduling, or vital signs documentation. Question 43. When making an outgoing call for the clinic, what is essential to do if you need to leave a message? A. State the patient's full medical condition clearly. B. Leave your name, clinic name, phone number, and a brief, general reason for the call. C. Speak loudly to ensure the message is heard clearly. D. Mention the specific doctor you are calling from to add authority. Answer: B. Leave your name, clinic name, phone number, and a brief, general reason for the call. This question relates to professional communication and privacy when leaving messages. You need to identify yourself and the clinic and provide your contact number so the recipient can call back. However, due to privacy concerns, like HIPAA, the reason for the call should be general, e.g., regarding an upcoming appointment or regarding your recent visit, rather than revealing specific medical details. Avoid speaking loudly, which compromises privacy if the message is overheard. Question 44. What is the significance of a medical assistant verifying patient demographics at each visit? A. It ensures the patient is eligible for discounts. B. It confirms the patient's insurance information is up to date. C. It guarantees the accuracy of patient identification and contact information in their record. D. It helps determine the patient's primary language preference. Answer: C. It guarantees the accuracy of patient identification and contact information in their record. This question focuses on the importance of accurate patient data. Verifying demographics, like name, address, phone number, date of birth, at every visit is crucial for maintaining correct patient records. This accuracy is vital for identification, billing, contacting the patient, and ensuring the right information is associated with the right person, preventing potentially serious errors in care or billing. While it can help update insurance, the core reason is accurate identification. Question 45. Which of the following is an example of a medical term using the suffix logi? A. Cardiology. B. Hepatitis. C. Nephritis. D. Arteriogram. Answer: A. Cardiology. This question tests the understanding of medical suffixes. The suffix logi generally means the study of. Cardiology, therefore, is the study of the heart. Hepatitis refers to inflammation of the liver, itis, nephritis refers to inflammation of the kidney, itis, and arteriogram refers to an X-ray image of an artery, gram. Recognizing suffixes helps break down and understand medical vocabulary. Question 46. What is the primary goal of a recall system in a medical office? A. To remind patients about upcoming social events hosted by the clinic. B. To encourage patients to purchase clinic merchandise. C. To proactively contact patients who are due for follow-up appointments, screenings, or preventive care. D. To track inventory levels for medical supplies. Answer: C. To proactively contact patients who are due for follow-up appointments, screenings, or preventive care. This question addresses the function of a recall system. The keyword recall implies bringing someone back or reminding them. In a medical context, its primary purpose is patient health maintenance. The system helps identify patients needing routine checkups, vaccinations, or screenings based on their history and established care guidelines, thereby supporting preventive health and continuity of care. It's about managing ongoing patient wellness. Question 47. When a patient refuses a recommended procedure, what is the CMAA's role? A. To insist the patient accept the procedure for their own good. B. To document the patient's refusal in their medical record after informing the provider. C. To immediately discharge the patient from the clinic's care. D. To schedule the procedure anyway for a later date. Answer: B. To document the patient's refusal in their medical record after informing the provider. This question concerns patient rights and documentation. Patients have the right to refuse medical treatment. The CMAA's responsibility is administrative, ensuring the provider is aware of the patient's decision and then accurately documenting this refusal in the patient's chart. This documentation is crucial for legal and medical continuity. The CMAA does not force treatment, discharge patients unilaterally, or reschedule refused procedures. Question 48. Which government agency mandates safety standards, such as the use of personal protective equipment, PPE, in healthcare settings? A. Food and Drug Administration, FDA. B. Centers for Medicare and Medicaid Services, CMS. C. Occupational Safety and Health Administration, OSHA. D. Health Resources and Services Administration, HRSA. Answer: C. Occupational Safety and Health Administration, OSHA. This question concerns workplace safety regulations. OSHA is the federal agency responsible for ensuring safe and healthful working conditions, including establishing and enforcing standards for hazards like bloodborne pathogens and requiring the use of PPE, like gloves and masks, to protect healthcare workers. The FDA regulates drugs and medical devices, CMS manages Medicare/Medicaid, and HRSA focuses on improving healthcare access. OSHA specifically covers worker safety in environments like medical offices. Question 49. What does the abbreviation CBC typically refer to in a laboratory order? A. Complete blood count. B. Cardiac calcium BOS. C. Culture and blood analysis. D. Chronic breathing condition. Answer A. Complete blood count. This question tests familiarity with common laboratory test abbreviations. CBC is a very common blood test that provides information about the different types of cells in the blood, including red blood cells, white blood cells, and platelets. It's a fundamental diagnostic tool used to detect or monitor a wide range of conditions. Understanding this abbreviation is essential for managing lab orders and communicating with patients about tests. Question 50. When handling potentially infectious waste, what is the correct disposal method for items like contaminated gauze or bandages? A. Place them in the regular trash bin. B. Rinse them thoroughly before disposal. C. Dispose of them in a designated biohazard waste container. D. Flush them down the toilet. Answer C. Dispose of them in a designated biohazard waste container. This question addresses medical office safety and waste disposal protocols, critical for preventing the spread of infection. Items contaminated with blood or bodily fluids, such as gauze or bandages, are considered biohazardous waste. They must be placed in specific, clearly marked biohazard containers, often red bags or bins, to ensure proper handling and disposal according to safety regulations. Placing them in regular trash or flushing them poses significant health risks.